Hi, my name is Mai Pham, and I wanted to talk with you today about Institute for Exceptional Care. My autistic son, Alexander, on the left here with my husband, David, and me, is an incredibly bright and articulate person. But when he's stressed, or if you ask him open-ended questions, he can shut down and seem almost nonverbal. In fact, like many people with intellectual and/or developmental disabilities, or IDD, Alexander expresses anxiety in atypical ways. I think that's one reason that his first psychiatrist misinterpreted his skin picking as obsessive compulsive disorder rather than the anxiety it was. That's why she gave him the right drug, but at the wrong dose and for the wrong reasons, and totally lost his trust. And that led eventually to his first mental health crisis. I started Institute for Exceptional Care, or IEC, as a nonprofit to make healthcare better for people like Alexander, who may have other conditions like Down syndrome or cerebral palsy. Some of them can't verbalize, but they all know what makes them feel good or bad. Maybe you're someone with IDD, or maybe you love or work with someone who has IDD. In fact, about 1 in 20 people, or 16 million people in America, is part of this group. And like Alex, each one has something special to offer. But what they also have in common, unfortunately, is that society thinks of them as other. People in healthcare are no different. Doctors or nurses may be well-intentioned, but they get less than 20 minutes of training in IDD. This lack of training has consequences. It's not surprising that people with IDD have bad health outcomes. They get half the preventive services as we do, the rest of us, things like colon cancer screening. They were denied ventilators and ICUs in the early months of the COVID pandemic because hospitals made wrong assumptions about their quality of life. They have high suicide rates, which particularly scares me as a mama, and they lose an average of 10 years of life due to preventable causes. I imagine we've all been in an ER. It's overwhelming to your senses. It's confusing, and you can wait for hours while you're sitting there in pain. Now imagine that you have IDD and think about what that must feel like. Making things better begins with basic respect. I remember one doctor crying while telling a story about how at his hospital, the written policy is that they have to sedate anyone who comes in with IDD first and then ask questions. As a mother, that just terrifies me about what would happen if Alexander has a medical problem and I can't be there. We want to make healthcare safe and inclusive, where people with IDD have dignity and support that lets them lead their best lives, so we can all be blessed with what they have to offer. What's unique about IEC is that we bridge the disability and healthcare communities. Many of us are healthcare experts, but we also have the lived experience of supporting a loved one with IDD, and that has helped us earn the trust of disability partners. We role model for our healthcare colleagues how to listen to the genius of lived experience and to get to solutions. We help these communities work together to solve problems like what happens in the emergency department. For example, our coalition on Long Island, the Seamless Care Alliance of Nassau and Suffolk, has created a digital app called Always Uniquely Me that a person with IDD or a family member can use in an ER. It has pages like tips on how to work with me, or things to avoid that trigger me, or ways to calm me down, like links to songs. Imagine what a difference this app would have made in that hospital where the doctor cried, so that they don't need to automatically sedate anyone. Patients would have better outcomes, and that doctor would have had humanity restored to his work. Community members are central to our work. If you want to learn more about how you can play a role, please visit our website at ie-care.org. You can join the IDD Advocate Corps, which is a new advocacy group that we're starting that brings together healthcare professionals and people from the community with lived experience to push for change in their own communities and then in other communities. You can participate in one of our projects. You can help spread the word about our work through your networks, and you can support us with donations. Together, I'm confident that we can make healthcare safer and more inclusive, and we can make sure it's a system where people with IDD have dignity and support that lets them lead their best lives and share their gifts with all of us. I'm looking forward to seeing you at our live event with Jason's Connection on December 14th. Thanks and take care.